We have 4 minutes for question and answer, so if there are any questions, I guess I can start. To Dr. Misha Zabarfian, the first talk on the PDT. So photodynamic therapy depends on many things, right? There are many variables can affect the efficacy of PDT. So clearly the incubation time makes a difference, temperature makes a difference. So in order to really assess all of these, you have to try to control for all of those things in order to be able to say which one of these compounds are more effective. So I don't know if you want any comment on that, or how do you even control for a lot of those variables,
Yeah, definitely. It's a good question. I don't think that we controlled for every single variable. We did perform the incubation as well as the treatments in parallel. So that was thought to be at least somewhat of a helpful factor in controlling some of the things like temperature that we can't control for otherwise. But beyond that, yeah, I agree with you. We need more studies and perhaps more sophisticated studies to control for all the variables that exist.
Yeah, that's true. Sorry, go ahead.
Thank you for this presentation.
You can introduce yourself too, if you don't mind.
I'm Dr. Shantala from Boston, and my specific question is what's the percentage of patients who end up having squamous cell carcinoma from lichen sclerosis? And the second one, is there any study of CO2 laser for dark-skinned patients with lichen sclerosis?
Can you repeat the second question, please?
Skin of color, like darker skin, 4 to 6 patients, and the CO2 laser for vulvar LS.
So to address the first question, it's actually a small amount of patients, I don't know the exact percentage, but it's actually a relatively small amount of patients where the lichen sclerosis transforms to squamous cell carcinoma. However, it's after years and years and years of chronically untreated therapy where that happens, and as it's a chronic disease, keeping the disease at bay with steroids and laser can help prevent that. To answer your second question, I have not seen a lot of studies on skin of color treated vulvar lichen sclerosis. However, I do have some friends and mentors that are currently working on that right now, and I do expect in the next couple of years for there to be a good amount of information on that, so stay tuned.
Yeah, I think it's a really good question, though, in terms of the skin of color. Most of the devices that we are currently using, even though there's a lot of talk now and the whole session on the skin of color right now, are really not that safe or effective for, the darker skin patients. So I think, that's why, and we have, I think, one of our committee members, Dr. Maradia, who's also part of the committee, the IDEA committee, that has been created to really focus on trying to create devices that are safe and effective for all skin types. So I think it's a really good question. Yes.
Well, yeah, Kevin, I have done. Sorry.
I was just saying, I have done maybe 3 or 4 of at least type 5 or 6 skin with dark skin lichen sclerosis, and I did hyperpigment them, but then it evened out, and I don't think anybody ever depigmented. And I've probably done maybe 30 total, and I've always been surprised that it hasn't done that, to be honest.
Thank you so much.
Well, when I've used CO2 in darker skin, what I usually do is a test spot first and wait a week or 2. And then, even type 6 skin, we've been able to treat with CO2. It's just, a question of doing test spots and seeing what kind of result you have. But, you have to be careful, obviously.
Yes.
I was just wondering if anybody has tried drug delivery for LS, that you Erbiumar CO2 first and then do clobetasol on top of that.
Sorry.
That's actually another study that is going on currently. But yeah, the use of clobetasol and then using laser therapy for activated CO2 is in the works. I'm not sure of any others at the moment either.
So that's a great question. Yeah, very good question. And I think Dr. Katz, quick question or comment. I think you mentioned to me briefly that, the device has also been used in female patients too, right? So maybe you want to comment on that part too.
Yeah, actually, this device, the Emcella device, we found actually we use more frequently in women for stress incontinence, particularly women after pregnancies or older women too. We found it works really nicely in some men with urinary frequency, nocturia. It's helped there as well. So, but I think the majority of our patients really are females with stress incontinence. Usually 4 treatments, and it really works. We do maintenance once a year after that.
Yes, yeah, perfect. And one quick question for Dr. Hasina. So regarding the CO2 laser for Darier's disease, so I saw in some of the pictures, the Darier's didn't come back, but there was hypopigmentation that was on the picture, and maybe a question of even scars. What are your thoughts about that? I mean, do you get scars on treating Darier's, especially on the trunk?
Yes. Was the question kind of about the hypopigmentation and if we can kind of avoid
Hypopigmentation
that?
scarring after
I think that was-
CO2 on the trunk. for
Yeah, that
Darier's.
was on all locations of the body, and an unfortunate kind of sequelae that was required to have efficacy. One patient, he didn't give permission to show the photos, but he, when we used more mild settings and fractionally ablative settings, and he didn't scar, but he did end up eventually having recurrence, so he was okay with us going back and doing ablative, but he did have a hypopigmented scar. So that's the very unfortunate aspect. We have to weigh like the
Right.
quality of life with like the scarring, and thankfully in like intertriginous areas in the trunk, it's not as limiting. But that patient you saw on the forehead, she didn't want to do the other side because of the scarring. So that's hopefully more research can come out of ways to do it without leaving such like disfiguring scars.
Makes sense. Makes sense. And one quick question for Dr. Alina. There's a lot of dental application of lasers. Maybe you can tell us just very quickly what lasers are most commonly used in dental medicine or dentistry.
Yes, I believe that would be the water lace by BioLace. The most
Sorry?
common laser used in dentistry would be the BioLace water lace laser.
Okay. Okay. All right. Very good. Well, thank you so much, everyone. Really appreciate it. We're going to keep going. Just a quick reminder, don't forget that there is a reception at 5 to 6:30, but we have a lot of other talks that are coming up, so let's go directly to the next one.